I think it's really important to emphasize that when and if crisis standards of care are activated in any region in the state of Idaho, that's part of the continuum. So here at St. Alphonsus Health System, and I would argue for all the health systems across the state, we're at the most extreme level of contingency standards of care now. So we're taking care of patients in clinical areas, generally speaking, but that may not have been dedicated for that purpose. Initially, we're looking at non-conventional areas like classrooms. Kootenai is taking care of, or is at least opened a space to take care of patients in a classroom. And so that's the point at which we then say this isn't just a contingency anymore, but it's truly a crisis because we're doing things that we would do under absolutely no other circumstance. And we begin to worry about the quality of care that we're able to deliver. So I'll speak for St. Alphonsus, we're at that extreme point. As long as we can continue to fit in the next patient that requires our higher level of care, whether it's in the intensive care unit, the operating room, or our medical surgical units, then we will not require calling for the activation of crisis standards of care. And I too am hopeful that we will be able to avoid this if it doesn't get much worse. But we are at that extreme. And I will also say that we won't hesitate to call for that activation when we feel that the ability to deliver contemporary or best standard of care is going to be compromised. And then we have to make some triage decisions about who gets the right care at the right time now versus who gets the right care with a little bit of a delay. And then, as I said before, crisis standards is a continuum as well. So just because we have that label and use it doesn't mean that we are letting people die, because that is not going to be the situation. We will always provide care. It's just how much we have left to provide.